My name is Melanie Schlittenhart, and I'm a nurse practitioner at an independent pelvic health clinic. Thank you for the opportunity to present our poster titled Gardnerella vaginalis is associated with UTI symptoms in both pediatric and older adult females. Now, when I have a female patient present with a primary complaint of dysuria, I love to put on my APP rose-colored glasses and assume that that patient will fit perfectly into a simple urinary tract infection with classic E. coli, no resistance, of course, and symptoms quickly resolve with a narrow spectrum antibiotic. But we all know better. This is certainly not going to be the case for many patients and with the same outcomes, of course. Despite our efforts and our research and our guidelines, our UTI patients often return. And as a clinician, it can be really challenging and frustrating when patients are symptomatic and our traditional labs offer limited information. However, with today's advanced methods, with polymerase chain reaction or PCR testing, the classical perception of sterile bladders is being reconsidered and challenged. This study takes advantage of the new technology and its ability to further study the urobiome and emphasize the importance of the gut, vagina, bladder axis in UTIs. And we talk about this all the time with our patients already, telling them that the gut and the vagina and the bladder, they all live in the same house. And this study looks at the living arrangements in this pelvic house, specifically its associations with Gardnerella vaginalis, which with our traditional testing often is considered then a contaminant. But these interactions could be important to note when managing complicated UTI cases. Our group went to the heart of UTI patients that we see every day in urology and urogyne clinics. And we tested females at a variety of ages with PCT techniques and efforts to better understand the diversity of their urobiomes. Here we note the results acquired with MPCR testing that G. vaginalis is detected in 12% of adult and 31% of pediatric female patients. Again, as we all know, G. vaginalis is not detected by standard cultures. These findings also include that women aged 60 and older, G. vaginalis was associated with altered urogenital microbiomes, forming interaction networks with other opportunistic uropathogens, including Mycoplasma hominis, Lactobacillus iners, and Ureaplasma ureolyticum. And social media has already been generating a urea plasma buzz, and your patients are probably asking you about this. And we just don't have a lot of information until we have studies like this generated. In the study, G. vaginalis was associated with symptoms such as pain, urinary frequency, exactly what our patients are presenting with in the clinic. And again, our traditional cultures are not helping us detect G. vaginalis. Our PCR testings are reshaping the understanding of our bladder microbiomes, revealing additional bacteria that's normally not found on our traditional cultures. This study recognizes Gardnerella vaginalis and its influence on pathophysiology of UTIs and the varying immune responses and microbial diversity, and therefore, Gardnerella vaginalis should be considered a potential pathogen in UTIs and necessitates further research to optimize treatment approaches. Thank you for the opportunity to present our findings.